Good afternoon to Europe. Good morning to the Americas. Good evening to our colleagues in Asia. My name is Robert Straw. I'm the CEO of CEIBS Switzerland. The view behind me is not a screensaver. This is a live shot of my office, of where we have seminars right here on the lake in Zurich. I'd like to welcome you all to the 12th webinar in our series called Lessons for Leaders from the Pandemic. We've had, over those last 17 weeks, we've had 12 webinars such as today's webinar. We've had 21 speakers and they've all been on time, which is great. We've had 1,800 unique viewers. We've had people attending from 63 different countries. It's pretty amazing. Today's webinar topic is the future of healthcare, East meets West. As you know, CEIBS is a bridge builder between the East and the West, particularly between China and Europe. This is the third webinar in the series of the three-part series that we've been running in partnership together with the Swiss Re Institute. And I'd also like to say thank you to the Swiss Chinese Chamber of Commerce, our long-term and close partner for marketing for this webinar series. I'd like to share a little bit of information about CEIBS. This is a program called Leading at the Edge. We're going to be running it in June and in January and in June of next year. It's a week-long program on leadership development, together with our own Professor Catherine Shin and Professor George Kohlrieser, Professor Emeritus from IMD. There's a link there. We're going to send this to you after the webinar is over, together with some other things, transcripts of also the presentations from both of the speakers. But we'd love for you to join this. I'd like to also welcome you to ask questions. At the bottom of your screen, you see two functions. One is called chat and the other is called Q&A. We'd ask if you've got questions during the Q&A period towards the end of the webinar. I'd like for you to use that Q&A section to address the questions to either of the speakers or one of the panelists. Something else we'll be doing when we send out a follow-up mail is we're going to ask you for your evaluation of, not so much today, but especially for those of you who've attended many of our series over the last 17 weeks. How can we do this better? We've got some other things in store for you after the summer holidays on the future of work, on finance for China, on some different topics. And we'd like to know more from you about what you would like to see from us going forward. I now have the pleasure to introduce our speakers. Professor Zhang is an assistant professor at the University of Colorado in Boulder. She's joining us this morning at just at 7 o'clock her time from Boulder, Colorado. We're very, very happy that she has joined CEIBS, and she'll be joining the CEIBS faculty right now, actually now in the summer, and she'll begin teaching for us in Shanghai, hopefully in September, hopefully that she can be able to travel there. She's, like I said, an assistant professor of economics, focusing on health issues. Her primary interest, she's been there since 2013. Her primary interests are environment and energy, health, development, and China. Evangelos Avramakis is the head of digital ecosystems R&D at the Swiss Re Institute. He's Zurich-based. He's a recognized thought leader and advisor in the insurance industry. He liaises strongly with academia in his role for handling the ecosystems of R&D, insurtech, medtech, and startup ecosystem. His focus covers digital and consumer-related topics, such as digital ecosystems, omni-channel management, and business model innovation. And finally, and this is something that we regularly do on our webinars, we invite an esteemed colleague or alumni or another expert in this area, and to speak as a panelist at the end. And so we're very thankful to have Gabriel Masfurroll. He's based in Barcelona. He has more than 40 years of experience in this area of healthcare. He's a CEIBS alumni. He attended our CEOs program a while back. He has extensive, really extensive experience in the healthcare industry. He's been founder, he's been CEO, president of USP Hospitals and a hospital group with a network of 35 private healthcare centers in Spain. So he comes really from the real practical side. So without further ado from my side and taking up more of your time, Professor, I will turn the microphone and the camera over to you.
Hi, everyone. Thanks for joining us. Thanks, Robert, for organizing this event and for having me. So I'm sure many of us have learned a lot about healthcare during the pandemic, and it's not over yet. We're still learning. And there are a lot I want to share, but today I'm going to focus on one point that I think is particularly interesting. And I learned a lot during the pandemic, that is digital health. So we will start with some simple data from China and the US, where I follow data most closely. So those data show online doctor visits last year versus this year. And in China, we're looking at Ping An Good Doctor, which has 80% of market share of those online doctor consultations. So Ping An Good Doctor released their data in February 2020, just 1 month after the Wuhan outbreak. And what they report is over the past month, they've had 1.1 billion visits for their online doctors. This is just a really impressive number. And compared to last year, from their last year, their monthly average is 22 million visits every month. So this is more than 50 times of increase just in a month, in the first month of the pandemic. And in the US, we're looking at Teladoc. So this is also a main market player in this field. They have 75% of market share. And if you compare their Q1, and I convert this to monthly average just to compare with the Chinese data. So their Q1 monthly average is 0.6 million. This is also almost doubled from the number last year in 2019. So this is also a very impressive increase. And considering that the pandemic hasn't really hit the US until mid-March, so their Q1 data actually might underestimate how much increase this is. But in any case, I'm sure if we look abroad, look at European data, look at data from other countries, we will see a similar trend. That is, we see a massive move in terms of the utilization of online doctor consultations. But before we talk about this really exciting movement, I want to take a step back and remind our audience that when we think about digital health in the context of healthcare, we want to go back to the fundamentals. So we want to go back to the very basic iron triangle of the healthcare system and really think about what role will digital health play within this iron triangle. So I'm sure most of you are familiar with those three aspects in digital, in healthcare: access to healthcare service, cost of healthcare, mostly healthcare expenditures, and the quality of care. So those three goals are the common goals of every healthcare system. Every country is trying to improve their healthcare system to try to maximize those three goals. But it's just really challenging to maximize three at the same time. So there is always some trade-off. For example, in the US, we know the US healthcare is mostly driven by private health insurance, private healthcare providers. It's seen as having high efficiency and quality, but it's the most expensive healthcare in the world. For example, the average annual expenditure of average American is over $10,000, which is almost more than double of many of the European countries. So in terms of cost, that's really the primary challenge. That's the most urgent problem in the US. And coming back to China, in China, we also face the trade-off, and we also have more urgent problems. For example, access. If you've been to the big hospitals in China seeking for sick, you might remember how crowded it is. And after waiting for a long time, you may not be able to talk to your doctor for more than 5 minutes. And it's always overcrowded to prevent the doctor to provide sufficient care to patients. So access has been a huge problem in China's healthcare. So when we think about health, digital health, right, where should it start? I think this really depends on each country's healthcare structure, right? What's the most urgent problem right now? That's probably where digital health should approach first. So let's talk more about access in China. I think this is really the primary challenge in China for a very, very long time, since the market reform in the 80s. And most recent move is the healthcare reform in 2009, where the government decided to spend billions in reforming the healthcare system to increase access. So 80% of the funds really goes to expanding access, as they want to address this problem in their Iron angle first. This is their priority. In terms of access, there is always unequal access to insurance coverage and benefits in China. So this reform has made very impressive progress by covering 97% of population in public health insurance, including rural and urban residents in only a few years. So this is really impressive movement, but still different regions, urban versus rural, the benefits, the reimbursement rate still vary substantially. And this still creates barriers for access for people in disadvantaged regions. So I would say this part of the access challenge still exists. And I think a more important problem in the access part is the lack of primary care-based delivery. And Chinese healthcare system has always been public hospital center system, right? We don't need a gatekeepers. We can go see any specialist as we want. And for a long time, people have this habit that no matter how minor the symptom is, they always want to go to the best hospital to see the best specialist. And that's the fundamental reason why Chinese hospitals are so crowded, and those specialists just don't have sufficient time to give care to their patients. So since this reform, a lot of the funding goes to building private care facilities, for example, community healthcare centers and family doctor centers, and training family doctors since the reform. But I would say that a lot of the change still stay at the supply side, and we don't see a lot of move in the demand side, which is on the patient side, that they still don't see those family doctors as their gatekeepers. So we've looked at the data of the patient flow from hospitals to primary care facilities. It actually doesn't change very much before and after the reform. So people haven't changed their habits yet, despite such a massive funding injection. So what does digital care change? How does digital care change access, especially during the COVID? I think because of the problem of access in China, there's a much larger gap, especially if we compare US and China. If we think about online doctors versus our physical doctors, right? In the US, it's more like alternative option, and there's always trade-off. It's easy, it's convenient to see your doctor on your phone, but you also don't know how much confidence you have on those online doctors. You might think about, private issues, especially regarding your medical records. So there's always trade-off between convenience versus confidence, as people have already established really strong confidence on their family doctors. Suddenly, right, if you ask them to switch to online doctors, there's a lot of uncertainty. But in China, there isn't such trade-off. I think that's a really interesting difference, that for the Chinese citizens, especially during pandemic, if you want to avoid hospitals, online doctors are probably your only choice. And you actually have more confidence on them because they are mostly from top tier hospitals compared to family doctors in those early stage community health centers. People are more reluctant to see those family doctors. So I think in China, people have both convenience and confidence on those online doctors. And I think that's one of the major reasons why we see a much larger increase in online doctor consultation in China compared to the US data, because of this larger gap in access to field in China. Another obvious reason is we know there's a higher penetration of mobile technology in China. Sorry, I lost my earphone. And this applies to every sector, not just healthcare. If we look at internet users making purchase via mobile phones in 2019, what's interesting here, you will see those Asian countries actually have a much larger percentage of people who are mobile phone savvy in making those online purchases. And if we compare the data in China versus the US, China, 74% of internet users make their purchase via their phone. In the US, only 44%. So this big difference in terms of how much you use your phone to do purchase also is a big indicator on how much you will see your doctor online, right? Since you have to make the appointment. So I think there's a still technology barrier in the US that people are not really used to this type of payment methods in terms of getting care. Okay, so that's mostly during the pandemic, right? But what's more interesting, what for us to think deeper is digital healthcare here to stay? And this will give us more, interesting points to think going ahead. And I think in China, the changes in access is just going to remain for a long time. We know it's not easy process to integrate this gatekeeping service to your healthcare delivery system. US started to introduce primary care service in the 70s, and it took almost 30 years to finally, get people to go to see their family doctors. And China just get started. So I will say this will be a really, really long process. And between now and then, there might be a couple of decades. And here is a time, I think, when people will gradually establish their confidence on telemedicine. And as long as they establish their trust on online doctors and they're happy with the results, it will be really difficult for them to switch back to traditional care. So I will actually say that the gap in primary care service will actually provide more opportunities for digital healthcare to go in the next few decades. But in the US, it's different, right? It's already a very established primary care service. And once the pandemic is over, few people go back to see their doctors. So that's a very realistic question. We're going to look at some early data. So the data from FRISIA, so this is a health technology information company, and Harvard University. So they collected data for over 15 million visits, including online and in person. So what they see is, okay, so the blue line here shows in-person outpatient visits from February to early June. So you can see in the peak of the pandemic in the US, it was down by 70%. But starting late April until recently, it comes back up. So we can see this rebound has pulled the reduction to only 20% from 70%. So this is a really big rebound. And considering that the pandemic is still going on in the US, we're still in a terrible situation. I think the pattern that people tend to go back to their doctors, this is very impressive. And in terms of telemedicine, we look at the green line. In the peak of the pandemic, in the early to mid-April, this reached 14%. So 40% of all visits went to their telemedicine, but it went down to under 8% last month when people had the option to go out and see their doctor. So I think those early signs really shows this substitution effect between actual doctors versus online doctors. And this gives me more thinking that without established primary care system, maybe in China, we wouldn't see such a quick rebound, but we don't know. We haven't seen data yet. We'll have to wait for data in China to track the movement in person versus online doctor visits. So my final point is I want to discuss more broadly going forward, what are the challenges and opportunities in the post-COVID time. I think in terms of challenges, insurance coverage is definitely one of the main challenges that both countries need to address. So we know in China, 97% of people are uninsured by public insurance programs, and the government has made big movements in their policy in terms of coverage of online consultation. The new policy came out in March this year, allows for follow-up consultations and repeat prescriptions. You can use your public insurance to cover those services from those online healthcare providers, but initial consultations are not covered yet. So that's still a big challenge. They are in progress in small scale pilot, but they haven't scaled up yet. There's also locality constraints. Currently, for example, if you are based in Shanghai, you have to see a doctor who's also based in Shanghai in order to get your insurance to cover your expense. So if you see a doctor who's based in Beijing, you have to pay that out of your pocket. So this is also something that policy definitely needs to address in the future in order to, allocate healthcare resources more efficiently across different localities within China. In US, I think this is even a big obstacle. We know the insurance structure is just very, very complicated. But to put it simply, about 56% have private insurance, 43% have public insurance, about 10% are uninsured. And the current problem is different health insurance schemes have different policies in terms of coverage on online doctor consultation. For example, if you have private insurance, it really depends on if your insurance covers online, and different health insurance companies have different plans. Public insurance in general don't. So Medicare and Medicaid don't cover your fee-for-service expenditure on online service. And this is actually a really, really big gap that the US policy hasn't addressed yet. And 10% of people, of course, they have to pay out of pocket. So you can see that almost half of the population still face the big challenge in terms of insurance coverage when they think about using their online healthcare providers versus going to a family doctor where they can get reimbursed, right? So opportunities. I do think that in China, at least, the opportunities really lay on the other two dimensions of the iron triangle. So remember the iron triangle mentioned in the very beginning. We mostly talk about access today because that's where it started in China. That's most urgent for digital care to play a role. But I think going forward, the cost dimension and the quality dimension will have more opportunities for healthcare providers to enter using digital technology. And one example I really like in the US is Omada. So basically they provide chronic disease management, specifically diabetes prevention. So what they do in terms of cost and quality is they provide health training programs and they work with employers and health plans to provide their program to their employees. Those qualified employees who have pre-diabetes, they work together, they work with the health coach, they follow up their data, and if data doesn't look good, the health coach will call them to give them personalized advice. And I think Omada has been doing well because it has provided clinical evidence that their program has statistically significant effects in weight loss and reducing diabetes rates. So in terms of the benefits, it really lowered the cost of employees, right, by reducing diabetes rates. And this also saves employers money by paying less health insurance premium next year. So it's really a win-win situation. And also employers pay them by the outcomes of their employees. So I think this is a really good example, especially as a lot of digital healthcare providers in China started to think about chronic disease management. There are good examples out there that we can look into. Okay,
very quickly wrap it up. We're way over time. If
so sorry. Yeah. Last page.
Okay, thank you.
Three takeaway points.
Thanks.
So just a summary of what we've discussed today. I think during the COVID, digital care really helped people to get access in China and in the US, more so in China, because of the larger gap in primary care, as we discussed. And the second point is, I'm all optimistic for digital care to stay in China's healthcare because the gap is going to remain for quite a few years. And finally, I do think that when we think about opportunities ahead, we want to think more about the two other dimensions, efficiency and quality, especially build evidence-based digital care. That will be very helpful for improving the healthcare system in China. Okay, sorry, Robert, I'm done.
Thank you very much. I like the passion, but we also have others that also have passion that we will also want to give some space to share. Professor, thank you so much. I'm going to turn it right over to you, Evangelos. Thank you.
Perfect. Thank you very much. Let me know whether you can see my screen, then I can start.
Yes, great, thanks.
Perfect. So we heard a lot. There might be some duplications in my presentation, but anyhow, let's get started and look what is happening. So when we talk about COVID pandemics, when we talk about exponential growth, now how does exponential growth look like? And only to show here a little bit a kind of animation from this to this one. So what we might need is not only, besides the classical healthcare environment, we need scalable solutions, and we need cost-effective scalable solutions. And during the pandemic, you can imagine how many insights you want to have in terms of where do I get this information? How do I prevent from doing something? How do I get diagnostic test kits? How do I get preventive supplies? All this kind of needs were there, but you can imagine how many websites that you need to get access in order to get to this information. What if we just could aggregate all these different needs from a consumer side into one single kind of application or into one single kind of interface? If we could do that, how would this look like in terms of a so-called classical healthcare ecosystem, where we combine different products, different services into one single interface? That is going to be very, very convenient for the customer. So it's about sharing services, and it's about integrating services. So let's look how we cope with that. We just heard it just before. There was an increase of number of downloads, especially in the healthcare app side, no matter whether there's a worldwide view or whether there's a local view. And now, if you look at the China one, just in the middle, you see only 25% of it. The reason why, because people had access to healthcare ecosystems already. And the rest of the world, well, perhaps not exactly the same way. So look at how did the US cope with that? So US, all the providers came up with a digital assistant, an assistant trying to cope with the COVID. So in terms of, it does a kind of a testing thing. However, all the services were not integrated at all. No matter whether it's Apple, Google, or other ones, they all had isolated solutions. If you go to Southeast Asia, so this is Korea. Korea did it a very digital data-driven kind of way. You could identify in Seoul, as an example here, where you might be at risk of getting the coronavirus. So where are the patients having actually coronavirus? So they opened up the system. That might be another kind of concern, in order that everybody could integrate their services of this kind of COVID services into any kind of app. So we had an explosion around coronavirus apps. And this is how you can more or less integrate it, with some serious concerns on the other side when it comes to data privacy, right? We just heard about this example now with Ping On, a huge kind of demand, and you see that on the right-hand side. This was a kind of super app in China, but others apps like in China did a pretty nice job, like WeChat. WeChat integrated also many kinds of healthcare services into their single app, into their super app. So you could get COVID testing, you could get a lot of information, a lot of education around that. So you don't need to download anything in addition, you had it on the spot. And similarly did the Baidu, and similarly did Ping On. So they all came up with very convenient services, naturally integrated in the natural touch point of the customer. How did Southeast Asia look like? So this is Indonesia. HelloDoc, a medical startup, if you want to start from telemedicine, again, they're integrating a lot of healthcare related services at scale. And they did, in addition, a COVID testing, kind of testing kit or service in addition. Please consider, they increased by 600% just due to coronavirus. So we need solutions that can really scale. But what if we go one step further? What if we get sensor data based on vital signs, something like heart rate, respiratory rate, oxygen saturation, perhaps blood sugar, perhaps oxygen levels, or blood pressure or temperature? And what if we can monetize, and not monetize, how we can monitor that, but also using data processing techniques such as artificial intelligence or machine learning, in order to intervene seamlessly with the patient. So what if we have a kind of continuous interaction with the customer in order to guide him what to do or what not to do? And there are some solutions in the market that is trying to cope with the kind of sensing intervention, like this one here. This is Binai from Israel. If you look into the screen of your mobile phone, you get all these vital parameters on your mobile phone, so you can already monitor that. If you want to do that in a continuum way, you can use the other one. This is a wearable device with medical grade kind of data insights. This means that you get the medical grade of data, and again here you process them, and then you can intervene and interact directly with the customers. So it's more about decentralization of healthcare provision. But also you can do that with COVID testing. There's a new kind of startup trying to do this. If you could COVID test actually at home, so where you don't even need to go anywhere, you decentralize the testing environment into your natural environment, which is the home, if you want. So we need to think about, how do we decentralize healthcare with providing decentralized mobile care, but also, from if you need to stay at home, that we come up with virtual care environment. And then if you really need serious kind of care management, disease management, that you go to hospitals or to specialists. So how are we coping with that? And the only answer is we need to disrupt the healthcare system. We need to come up with scalable, cost-effective, evidence-based solutions. And if we use this kind of wearables, like I showed before, or mobile technology, we can early detect this kind of early warning signs in order to direct the customers in a better way. So if we do that, we adapt towards the current needs and we empower the patients and users, or not patients, if you will, if we empower them in order they can act appropriately. So let's sum it up. We need to come up with scalable solutions, and we need to integrate and share services into a single kind of interface. The interface that belongs to the customer, the interface that belongs to the consumer. Second, we need perhaps to go further in terms of sensing and intervention. We need to have continuum kind of monitoring intervention with patients going forward. And the last point was more about we need to adapt this new environment into, let's say, by using disruptive technologies in order to make the world and societies and the population much more resilient. Only two last points. This is an overview how Asian countries were using technology. We're using different data sets, and it's not going to be compatible with the European standards. It's not going to be compatible with the US standards at all. You see that many data points we don't have access based on our current regulation or privacy kind of regulations in addition. I don't want to say this is the only way of doing it. These are the latest figures on number of deaths within the North America on the left-hand side, the European countries, and the Asian countries on the right-hand side. Perhaps we might need to think about how to best use data in order to make our world much more resilient, and how do we use evidence-based interactions in order people and population can know how to behave and when to behave. So we need definitely scalable and cost-effective solutions. With that, I'd like to close. Thank you very much.
Thank you both very much. Wow, that's very impressive. I love the passion from both of you. Before, we've got a lot of questions coming through from the audience, from the participants. Thanks very much. Before we go there, I'd like to hand it over right away to Gabriel. And Gabriel, just 2 or 3 minutes on your first impressions and reactions as a man who's been really involved in the management of healthcare systems for many years. What are your views and what's your impressions from Professor as well as from Evangelos?
Well, can you hear me?
Yes.
Yeah. Well, I'm also impressed. I have an advantage that despite I'm an entrepreneur and manager in the healthcare industry for 40 years in several countries, because despite I'm based in Barcelona and I developed my career in Spain, and also I've been involved in US, UK, Switzerland, even Switzerland, France, even Latin America, even Africa. That means that I know pretty well, except Asia, I know pretty well the healthcare sector. I was telling you that I have an advantage. I'm teaching in the ESA Business School in Barcelona in the healthcare. Many years I've been in the healthcare sector as an executive, also, and in the last 20 years as an entrepreneur. I've been also very much involved in the educational field as a professor, vice professor at the ESA Business School, and I'm the chairman of board of trustees of Universitat Autònoma de Barcelona, one of the top public universities in Spain. And I was telling the point of view from professors is sometimes different from executives. To tell that the vision of the executive is that this is not only a healthcare sector crisis. This is a global health crisis that affects the whole world, affects all the countries with different political systems, with different healthcare systems, with different cultures, with different dimensions. But all of us, we are affected by the COVID-19. And this is very important. The healthcare sector, it's just a piece of this situation. We are more or less, it's probably not it's a good comparison, but we are like the parachute of the crisis. The COVID pandemic, it's like a tsunami. It's not a sector crisis. It's something that it's coming. Nobody knows where and how it's coming, but it's affecting all of us. And it's not only affecting the healthcare sector. It's affecting all the industrial and economical sectors. And this is very much important. We are still, because I don't know what's happening in countries. Well, I know what's happening, but I can't talk. But we are still the head of the world. This is not finished. In Spain, they are coming back to the crisis. Areas of Spain, we are not controlling the situation. Well, countries are passing exactly the same. I would like also to say that meanwhile the sector it's seeking formulas, all kind of formulas to alleviate the consequences of this terrible pandemic. But these are our only urgent formulas to try to palliate this situation. But e-health, all the technologies are just little adds, little helps to surf this tsunami. Surely, some of these formulas are invented and applied urgently. Some of them, they will remain to be developed in the field, in the pandemic, and others. However, and for me, it's the most important, we never forget that despite the incredible technological advances, the human factor, for me, the human factor is essential in the sector. Whoever decides to subject the human factor to technology is wrong. Human factor is, for me, crucial. We can invent everything else. I'm 40 years in this sector. I saw all the advances, all the new technologies. But our professionals, and let me insist that the healthcare sector and once the healthcare sector is probably one of the most sophisticated and difficult to manage sectors in the world. Why? Because we have a lot of talent. We have a lot of people with very talented, with a lot of egos, with and a lot of vanities, working together, and they have to create a strong teamwork. And to manage the healthcare sector is very difficult. But we mustn't forget that human factor is the most essential. Okay?
Yeah.
What should we do? Along with the concept of, excuse me?
You've got about 1 minute, okay?
Okay.
Spaghetti.
A Spanish minute
No,
or
a Swiss minute. A Swiss minute.
Swiss
Really,
minutes, Swiss minutes, it's only 10 seconds.
yeah.
Well, my message is that we have to transform the healthcare sector in a global health sector. That means it's environment, it's nutrition, many other sectors are around of the healthcare sector. And that means that if we want to improve of the human beings, we have to work together all the no. And finally, to be short in my explanation, education it's crucial. Education is crucial. We have to use our universities to work and teach our young people that healthcare, the health, it's not only the healthcare sector. It's good environment, a lot of things together. And this is for me the circle, the virtuous circle that where we have to go. Healthcare sector is very important, but we are only the parachute. We have to change the healthcare sector to life science sector. This is the message. And finally, it's the last word that I said some days ago. The most important is that in front the common enemy we have in all the world, that COVID, an invisible and uncertain enemy, we have to join efforts. We have to cooperate. We have to be transparent. We have not to compete. We don't have to compete. We have to be united. And that time, I think the world is going against this trend. My message is we have to unify our efforts to win this diabolic enemy. Thank you very much.
Thank you, Gabriel. I'd like to stick on one point here that Gabriel brought up and hear a little bit from you, Professor Zhang, and from you, Evangelos. You're both promoting a heavy digitalization and technology. And, you know, in the last months, I also, as a manager and an educator, have learned that the people side of things, balancing with the technology is the key. We can't just do it. It's not just the technology and it's not just the people. This balancing is going to be very, very difficult. And in this future, to have for doctors and health professionals to have even better bedside manners than they do today. And in many, many countries, they're already poor. They're just poor. You know, you go to be taken care of and they might know the treatment, but they don't treat you as a person. They treat an illness. Is there anything here about your work and your thoughts about how to keep it human as we technologize, as we digitize?
So I think technology is just an enabler. So it's not replacing something, it's allowing something to happen in a much more disruptive way. So if you just, now telemedicine is a great example, you just shift the channel from on-site into a kind of digital environment. However, if you don't increase value only by shifting channels, now it's not much of value add. Okay. So we need to think how to use technology in order to augment our interactions with patients and with communities and with doctors. So it's an enablement focus and not a, you know, we're gonna get disrupted.
I hear for 10 years, I'm gonna be a little bit provocative. I hear for 10 years this word disruptive innovation, be it in banking, be it in technology, be it in healthcare, be it in, so what's different here? Give me two of the main areas we should focus on first.
For me, okay. Go ahead, Evangelos. Go ahead.
No, for me, it's just based on the theory of Clayton Christensen. If you follow his examples, if you follow what is happening and how it's happening, it's just happening. It's not a matter of whether or it's just a timing issue, right?
Okay. Yeah.
And now we have accelerated kind of exponential technology, and this will impact our daily lives. I mean, what we see now happening in Southeast Asia. So I show the example in Indonesia. It's a great example how communities more or less leapfrog many technologies in between. And I think we're just hesitating. We don't know how to use technologies the same way. And on the other hand, if it doesn't provide enough value, it's just not going to happen. So look at the financial sector is being now in the way of being disrupted. The same will happen in healthcare. The same will happen with any sector. So it's not a question if or when, it's a question how to get prepared. That's the question to ask.
Yeah. Professor, any thoughts on your side about this balancing technology with the human factor?
Yeah, as much I admire those high tech knowledge, but I do think we have to be more careful about healthcare because it's such a complicated industry, and people are particularly risk averse in healthcare. So I think that's very important. I think for any technology to help, again, we have to go back to the fundamentals. That's why I keep emphasizing we have to think about the iron triangle in particular context, right? The problem in the US is not the most urgent problem in China. So I think in a particular context for technology to really play a role, it has to understand which dimension of the healthcare has the most urgent challenge and how can this technology help to add value, as Evangelos said.
Yeah.
So, yeah.
But in a way, we get into a philosophical discussion about data, about the role of the state, the role of, it really comes down to that level. When we look at the use of data in Europe versus the US versus Asia, it's very different. The cultural differences are phenomenal. So, yeah, Evangelos, you presented very early a very nice slide of the ecosystem and how it would be great if we had all this data. And yet, Mr. and Mrs. European and Mr. and Mrs. America do not want you to have that data, even at the cost of their health. And in parts of Asia, I'll be a little bit provocative. We don't ask you if you want the data. If you want to give it, we just take it because it's in the sense of national security. How do we balance this personal freedom versus national, in the case of the COVID, especially national security?
I would challenge that. So if you're a Facebook user, WhatsApp user, Google user, I mean, we don't really own the data and we don't know what is happening with it. So forget the East-West. The question is, how do you provide value and better experience for human beings? That's the only question to ask. Perhaps technology might help, perhaps there's something else, but it's about value creation at scale. If the data is going to be misused, then we might need to regulate it, right? That's the question you're asking. But on the other hand, ask customers whether they would like to have one single interface that's managing their health, or whether they want to have 20 interfaces. Ask them. Ask them how they would like to be treated. Ask them how they would they get access to data and to healthcare records. I mean, we struggle in Europe to integrate and to standardize the data sets. This is the way we are. And we struggle to do that in a European way in addition, right? So we might think we need more urgency and more tangible outcomes in order to get it done. And so it's a political, but also a societal issue that was mentioned also by Gabriel as well.
Right, to pull together, yeah. There was an interesting question that came up, if I can go right to that. And I'm going to read it to you.
Tell you that something important that.
Okay. Gabriel, we're listening.
Just to tell that, can you hear me?
No.
Now? No? And now?
Yeah, try it again. No, I'm sorry, Gabriel. It's not.
Which is a disaster. This is worse than.
It's frustrating. I know. Yeah. Okay. Let me go back and ask this question. The question is, elderly care homes, so the senior homes around the world, have been prominent features in the pandemic discussion with the death rate, particularly in these care homes, significantly contributing to global death rates. We hear in Spain, we hear in Switzerland that the vast majority of the deaths are happening in these homes. What long-term effects will this have on residential homes and the rest of the population? Can digital healthcare help? How could this help? I know these are big questions, but maybe, Professor, if you have any thoughts on this?
Yeah, I think the comparative advantage of those digital technologies is tracking and monitoring, right? And that's also the main purpose of those elderly homes, that you can monitor their situations and you can give them proper care. Mm-hmm. So maybe in the future, if we can use digital technology to do the monitoring job, we don't have to have those elderly homes. For example, that's one possibility, but I think that's a really long way to go.
So by wearing the apps and the things and having the data that's tracking
Upload the data exactly within the ground, your doctor will call you, your nurse will come to you. So I think that's the beauty of the data, right? We have to really track the data to know what's going on.
Yeah. Gabriel, any thoughts on that? Yeah, his not working now. Evangelos, any thoughts?
Yeah, I think it's not a technology problem. Okay. Here. So I think, my father's suffering from Alzheimer's disease. He lives in Greece. He will never perhaps wear a wearable that is, something like home monitoring something, because he would say with 80, 90 years old, I don't do that, right? It's more a human thing. I would love to have this technology, in order I can support whatever I can from so far away. But it's a human thing, like was mentioned by Gabriel. So again, it's not a technology problem we have here. It's about how we adopt and how we use it. That's more the human factor.
Interesting. I'm going to go to some of the questions more that are online. We had one question about Beat Maya asked the question.
Hello?
Gabriel, do you want to say something?
I'm here. Can you hear me?
Yes.
Okay, I changed my gadget. I changed my gadget. Well, so sorry.
That's
but,
okay.
I'm here again. This is the good news. I lost a little bit the last time of the questions. Can you remind me what's the question you told me before, please?
Yeah, let me ask you a new one. So you recently, I've got one for you. It says you recently you were featured in an article on our website, actually, in CEIBS. And in the interview, we were interviewing you, and you said your quotation was, "The best system is a combination of a solid and powerful national system with quality academic and research functions cooperating together with a lighter but more agile private sector to work closely to patients." So the question out of this, and this is Evangelos is smiling because this goes in line with his ecosystem. Do you think that the pandemic will encourage healthcare systems more in this direction? And which healthcare systems have you seen to be the most effective during the pandemic?
Yeah, this is the billion dollars or billion euros or billion anything else answer. This is a fight between the common sense and the politics. GDP of the healthcare sector percent. Okay, 3% of these 9% correspond to the private sector. But sometimes, and especially with the COVID pandemic, the governments, different governments, because in Spain, you know, we have 17 autonomous communities. Some of them, they didn't use enough the private sector. Some of them even they used hotels. They opened hotels to transfer patients for COVID, instead of using private hospitals. That's the reason, because I am for many years a defender of aligned the private sector and the public sector, because we must not forget that the public sector their resources are coming from the productivity of the private community, you know, of the citizenship. That means that in case of one pandemic like this, the governments, they have to put all the resources in front of the community, you know, and this is so much important. And that's the question. And responding you were talking meanwhile I was seeing my budget. We cannot compare Asia with Europe or America. Even we cannot compare Singapore with China, or San Marino with Germany, or Costa Rica with the States. We have to be very careful, because not all the countries are exactly the same. Every country has his own culture, his own roots, his own politics, and his own basic and cultural cultures. The last month, I was listening and reading in different media comparisons that I felt terribly bad, because they are absolutely unfair. Okay. Every country, it's quite different from other. And well, it's something that I would like to point out.
Yeah. Okay. I see we're running out of time, unfortunately. The topic is pressing. It's very pertinent for all of us. Many of us have been really confronted very closely in our immediate families, or our extended families, or friends, and by this situation. And we know that these types of pandemics are only going to increase. So this urgency is only increasing. Before we go out, I'd like to give the word back to each of you for 1 minute for any closing thoughts. And I'd like to start with you, Professor. Any closing thoughts you would like to share with us?
So I think that what we learned from the pandemic is only the start, right? As we talk a lot about digital health, I think the pandemic has helped to make a big step in terms of the most urgent challenge. But looking forward, I think looking for evidence-based solutions, looking for value-based outcomes will be the future of digital health. And that's also a competitive advantage compared to the traditional healthcare, where it has been very challenging to measure outcomes, to measure values. But hopefully digital health can help on this dimension by introducing data monitoring to be able to measure value, to be able to measure outcomes.
Thank you. Evangelos, any final thoughts?
Sure. I don't You know, to me, as just mentioned before, technology is just an enabler.
Mm.
The question is, do we have enough urgency and pain in order to transform in a much more accelerated way?
Yeah.
And what I'm missing is the adaptive environment that really wants accelerated speed.
Mm-hmm.
I see more hesitant towards change and not more, you know, accelerate, let's do it together and let's be very, very, very fast on doing that. So this is to me a human factor that needs to be considered.
Despite almost 12 million cases globally and almost 600,000 deaths, right? I mean, just what is it going to take, right? Yeah. Gabriel, any final thoughts from you?
Yes, thank you very much. Well, I would like to insist, because I don't know if I had been capable to transfer my message. It's pedagogy from all of us, from the universities, from the schools, from the governments, from the media. The COVID pandemic, it's in our hands. The health sector, it's only a step. And I would like to insist in this issue. We have to cooperate between countries, between continents. Despite our ideas, we have to work together. We have only one enemy, and this enemy, it's the virus. We don't know the virus, and we are still in the crisis, and the crisis has not finished. We didn't find the solution, and this will take time to find the solution. Please work together. Work together. Thank you very much.
Thank you all. In closing, we're over time by 11 minutes. Thank you for those who stayed on. Again, we could keep talking about this. It's meant to be as a sampler, as a awakening call. As a follow-up, we will be sending a mail to all of the participants with a couple of the slides from Professor Zhang, and as well as from yours, Evangelos. And we have many questions that came from the audience and the participants that we couldn't answer today. And we might come back to you and ask you to give a short written response to some of those, if you would be willing to. We'll also send you all a link to Swiss Re's, some of the work that Swiss Re's done on this, as well as their Sonar report on risk, which is mentioning last time. I'd like to thank all of the speakers today. Professor, thank you again very much for joining us so early in the morning in Boulder, Colorado. So you had to get up at 6 o'clock today. And again, welcome, very, very warm welcome to CEIBS, to the family of CEIBS. Evangelos here in Zurich, thanks so much for your insights. And Gabriel, thank you very much for your expertise and your willingness to be a part. Dear participants, thank you for your faithfulness over the last 17 weeks. We're very glad to see so many of you come back week after week to listen to the webinars that we have. I hope it's been helpful for you. We'll see you in a few weeks' time after the summer break. Thank you all very much. Bye-bye.